Hi guys, Dr. G here with day 15 of Checkups with Dr. G, and we are officially halfway through our 30-day journey. Thank you guys so much for taking this journey with me. I hope that there's at least one video in this whole process that helps you or someone that you know. So today we're completing the conversation about diabetes. Yesterday we talked about some of the lab tests that are done for diabetes to determine if you have it and your progress if you are determined to have it. We talked about some of the signs and symptoms. We also talked about risk factors as well. And again, we are mainly focusing on type 2 diabetes. So today we're going to talk about complications as well as some of the preventative and treatment options that you have to kind of help offset the symptoms, or in some cases help reverse the symptoms of diabetes altogether. And again, we're focusing on type 2 diabetes. So in type 2 diabetes, as we said yesterday, is considered insulin resistant diabetes. So that increases the amount of sugar that's circulating in your blood. As a result, you can have damage to nerves and other organs and systems. So, as a result of the damage that's done to your nerves, you may experience numbness and tingling in your legs and your lower extremity, like your feet, your ankles, your toes, again, legs. And a lot of people are familiar with that as a complication. It's called diabetic neuropathies. But you can also experience things such as nausea and vomiting, diarrhea, constipation because of the damage to nerves. So those nerves affect the GI tract and cause disturbances in your GI tract. For men, having nerve damage as a result of diabetes can result in erectile dysfunction. So it's important to make sure that you're monitoring your diabetes and making sure that you are that you are doing the steps that you need to do to make sure that it's controlled. Other organs and systems that are affected by the excess sugar include your blood vessels. So there can be blood vessel damage, as well as damage to the heart. Your kidneys can be affected. I know a lot of people have seen diabetic patients that end up having to go through dialysis. You can also have damage to your eyes. So there are changes that will happen with your vision. Some people may experience glaucoma as a complication of diabetes. And so again, it's important to make sure that you are keeping it controlled, if not trying to, again, reverse or stop the progress of it. Also, there are studies out there that say that there's a correlation between diabetes and a increased risk for Alzheimer's disease. So you want to be mindful of that as well. Some people have had family members or even themselves have had to have limbs removed or fingers removed as or toes even removed as a result of complication from diabetes. And a lot of that has to do with the fact that you have again, the nerve damage, the blood vessel damage. You have slower healing time with diabetes, and you have an increased risk of infection with diabetes. So your body is not able to recuperate or recover from wounds as it would if you didn't have diabetes, which can put you at greater risk for amputations. So besides, all of those damages or complications that can come as a result of diabetes, it's just important to make sure you stay on top of it, because you can also go into a diabetic coma if your diabetes is too high or your blood sugar levels are too high. So you want to make sure, again, that you are taking the steps to control your diabetes and that you're actively working to decrease symptoms, or try to reverse the symptoms as much as possible. So some of the things that you can do to help with that includes changing your diet. So of course, we know you need to reduce the amount of sugar that you're taking in. You need to avoid things. We talked about that the other day when we talked about diet and nutrition. You want to stay away from like white breads and white rice and white potatoes, those more starchy vegetables. You want to make sure that you're doing low fat, high fiber foods. And the fiber is just going to help to absorb some of that excess sugar and, allow your body to get rid of it. You want to make sure that you are moving. When we talked about movement the other day, we discussed how, sedentary lifestyle is a risk factor for diabetes. So you want to make sure you're moving. If you are obese, again, we talked about how having that excess weight in the abdomen, hips, and thighs is a risk factor. And so you want to make sure that you are working to, reduce your weight. Also, stress reduction. When we talked about stress, we talked about how that's a complication, or how diabetes is a complication of chronic stress. And, just making sure, again, that you're getting up, you're getting moving, making sure you're hydrating properly, and doing all of the small things to keep your body at its best place for health and healing, those determinants of health that we talked about. Now, some of the things that we may use to help to treat diabetes include fenugreek. It is a herb, and I think you can get it in a powder form as well. It's an anti-diabetic herb. There's also bitter melon. Now, it does not taste great. If you buy the actual melon and try to cook it, it does not taste great, but it actually helps to reduce blood sugar. Some people have had supplements that have things like chromium in them. Chromium kind of helps to helps your body to take up the glucose. And also alpha lipoic acid, that helps with the diabetic neuropathies. It's an antioxidant, and so that's also a great supplement to use. You also want to avoid things like alcohol. Alcohol has sugar in it, so you want to be mindful of that when you are, especially leading into the holidays. I know people like eggnog with a little extra in it. Some people like to have a glass of wine with Thanksgiving dinner and all of that stuff. But just be mindful of the fact that alcohols have sugar. And so you want to avoid as much of that as possible. And if you're going to partake, make sure that you are monitoring your blood glucose levels so that you can offset it, with your medication as need be. So again, guys, today was just to finish off the conversation about diabetes. If you have any questions, please feel free to comment below, to send me an email at wholeyouwithg@gmail.com. You can also direct message me here on Facebook, on Instagram, Twitter at wholeyouwithg@gmail. Oh wait, sorry, wholeyouwithg. And also, guys, if you or someone is dealing with diabetes and it's uncontrolled, please make sure that you are following up with your healthcare provider. Again, besides these complications that I talked about today, you are at risk for coma or even death if you are not taking care of your diabetes. Both diabetes and hypertension are very serious diseases, and that we don't need to take them lightly, especially us as people of color, or in the African American community. Since these are things that are very impactful to our community, we want to make sure that we are staying on top of it, because we don't want to just look good on the outside. We want to make sure our insides look good as well. All right, guys. So I will see you guys tomorrow for our live video on day 16 of Check-Ups with Dr. G. And again, on Thanksgiving, there will be no video, and I will follow up with you guys on Friday. I hope you guys have an amazing day. It's day 15. Good night.